It wasn't the thing you think it was.
The moment that your back went wasn't the cause. It was just the moment that the cup overflowed.
Most people who experience a back flare-up can tell you exactly what they were doing when it happened. Picking up a bag, sliding awkward twists getting out of the car, one extra rep at the end of the session.
And they spent a lot of time trying to avoid that thing, that specific movement, that specific exercise, because in their mind, that is what caused it.
But here's what's actually true. That moment wasn't the point where your body ran out of capacity. The real story started much earlier.
Today, we're breaking down how back flare-ups actually develop, what capacity means for your body, and why understanding this completely changes how you think about your low back.
So, if you're watching these, there is a good chance you have been through this cycle at least once. Your back flare-ups, it is painful and frustrating. You rested, it settles down after a few days or a week. You get back to normal, and then a few months later, it happens again.
And each time it happens, it feels a bit random because the trigger is always slightly different, which makes it really hard to connect the dots.
And that randomness is what makes it so frustrating because you generally can't predict it. You are just waiting for it to happen again.
What we want to do today is to remove that randomness because flare-ups are rarely random. They usually follow a pattern. And once you understand that pattern, you can actually start to see them coming.
And more importantly, you can start doing something about it before they happened, not just after.
Okay, so let's introduce the framework that we're going to use to explain this, because I think that it really helps to make it clearer. We're going to talk today like your body is this cup.
The cup.
The cup. What this cup represents is your body's total capacity to handle physical, emotional, and chemical stresses on a given day. When that cup is empty or even half full, your body can absorb a lot. It can handle things like training, can handle long days sitting at a desk, or even that awkward movement, because it has capacity in reserve.
But when the cup is nearly full?
When the cup is nearly full, even a small thing can tip it over. A bend, a sneeze, literally picking your pen up off the floor. And that's the moment most people experience as the cause of their flare-up.
So the pen didn't cause the flare-up?
No, not even close. The pen was just the last drop. The cup was already full before that movement.
I love this analogy because it completely reframes the conversation. It stops people from obsessing over the trigger and start them thinking about what was filling the cup in the first place.
Exactly. And that's where the real insight lives, because the trigger changes every time, but what fills the cup up tends to follow a consistent pattern.
So let's talk about what actually fills the cup, because I think people underestimate how many things are contributing.
Right. And this is really important. It's not just physical load. The cup fills with a combination of things. Prolonged sitting is a really big one. We talked about this last week. Long periods in one position without movement reduces your body's ability to manage load effectively. So sitting for 8 to 10 hours fills your cup.
Even if you feel fine while you're not doing it?
Even if you feel completely fine. The body is still adapting to that position, and that adaptation has a cost in terms of capacity. Training is another one. And this is where it gets interesting for people who exercise regularly. Because training is a stress. It's a positive stress when managed well, but it's still a stress nonetheless.
So if someone is training hard, sitting all day and not recovering properly, all three of those things are filling the cup simultaneously.
Simultaneously. Exactly right. They compound each other together. Sleep is also a massive one that people underestimate. Poor sleep reduces your body's ability to recover and regulate pain sensitivity. So a few bad nights of sleep can actually meaningfully reduce your capacity to handle physical stress.
Which means the same training session that felt fine 2 weeks ago when you were sleeping well might tip the cup over now.
Exactly right. And then there's psychological stress. Work pressure, life pressure. We know from research that psychological stress influences how the body experiences physical load and pain. It's not separate from the physical system. It's a part of the same cup.
So someone going through a really stressful period at work, not sleeping well, sitting all day, and still training at the same intensity they always do.
Their cup is filling up much faster than usual, and they often don't realize it until it spills over.
Because they feel fine until they don't.
Exactly right. And that's the thing about capacity. You don't always feel it depleting. You feel it when it runs out.
Okay, so this is the part I think is really important, because this is where people get stuck. When the flare-ups happened, the brain immediately looks for a cause, and it lands on whatever was happening in that moment.
Exactly right. It's a completely natural response. The brain is wired to find patterns and assign cause and effect. So if you're bending forward and your back went, your brain files that away as bending forward caused this.
And then you become cautious about bending forward, which might not even be the right thing to be cautious about it.
Exactly right. And because bending forward wasn't the problem. The bending was just the movement that happened to be the last drop.
Do you see these in clinic a lot?
All of the time.
Okay.
Yeah, so people come in and they've been avoiding certain movements for months, even years, because they associate them with a past flare-up. And sometimes that avoidance actually creates more problems because those movements are often the things that the body needs to be doing: bending, rotating, and hinging.
So by avoiding the movement, they are actually reducing the capacity further.
Exactly right. Which then makes the next flare-up more likely, not less. It becomes a cycle: flare-up, avoidance, reduced capacity, and then flare-up again.
And the person can understand why it keeps happening because they've been careful.
Careful in the wrong direction. Careful about the trigger when the real focus should have been on what's actually filling the cup.
So let's talk about the recurring patterns, because this is what problem-aware people are really experiencing. It is not one flare-up, it is a cycle.
Exactly. And the cycle tends to look like this. A cup fills slowly over a period of weeks. Maybe sitting increases because of a busy work period. Sleep drops off, training stays the same or it's increased. Recovery gets deprioritized.
Nothing feels alarming in that moment.
No, nothing feels alarming. There might be some low-grade stiffness, a bit more tightness in the mornings, movements that feel slightly heavier than usual.
Which most people just push through it.
Exactly. Most people just push through and then the cup spills over. The flare-ups happen and then the person rests. The cup empties back down a little bit and things start to settle.
And then lives go back to normal, the cup starts filling up again.
Exactly right. And then that cycle repeats, sometimes every few months, sometimes more frequently.
Okay, so what's interesting is that the warning signs are usually there before the flare-up. The extra stiffness in the morning, movements that felt a bit off, the body was communicating, but because nothing felt serious, it got ignored.
Exactly. And this is why understanding capacity is so valuable, because it gives you a framework for reading those early signals, not as random background noises, but as information that your cup's starting to get full.
I want to share something we see constantly in clinic, because I think it illustrated this perfectly. We'll have someone come in after flare-up, and then when we go through the history, they will list 3 or 4 previous episodes, each time a different trigger, a different movement, a different exercise.
And they've been trying to manage each trigger individually, avoiding these exercises, being careful with that movement, building up a list of things that they think that they can't do.
But when you look at what was happening in their life in the weeks before each flare-up, the pattern is almost always the same. Increased sitting, disrupted sleep, training load staying high while recovery dropped, or a stressful period at work.
Exactly right. The triggers were all different, but the cup was full each time.
And then when you show people that pattern, something shifts, because suddenly it's not random anymore. It is understandable, and if it is understandable, it is manageable.
That shift in understanding is genuinely one of the most valuable things that can come out of a good assessment. Not just knowing what to treat, but also helping someone to understand their own pattern.
Because once you see it, you can't unsee it. And you start making different decisions, not out of fear, but out of awareness. Okay, so practically speaking, if someone is watching this and recognizing this cycle in themselves, what are some useful starting points?
Some useful starting points. The first thing is to start paying attention to the early signals. That morning stiffness that's a little bit worse than usual. Movements that feel heavier or more restricted. A general sense of fatigue that just isn't tiredness. Those are often signals that the cup is getting full. And that is the moment to pull back slightly, not push harder.
Okay, so which goes against the instinct of a lot of active people.
It really does. Active people tend to push through discomfort, which is a great quality in a lot of contexts. But when it comes to managing capacity, it can work against you.
What about managing the things that fill the cup?
The things that fill the cup, that's where we start to have a real impact. You can't always control work stress, but you control how much you move throughout the day. You can prioritize sleep. You can also be more strategic around training load during high stress periods. Also, reducing intensity slightly when you know life is getting busier doesn't mean that you're losing progress. It means that you're managing your cup intelligently.
Wow, so train smarter, not harder.
Exactly right. And the people who tend to do that tend to have far fewer flare-ups over time. Not because they're avoiding things, but because they're keeping that cup at a manageable level consistently.
Now, if you are in this cycle and you've been trying to manage it on your own, there's a real value in getting a clear picture of what's actually driving it. Because the cup analogy gives you the framework. But understanding what's specifically filling up your cup and what your body is doing in response, that requires someone to actually look at it properly.
And that's exactly what a thorough assessment can provide. We're not just looking at the side of pain. What we're also looking at is movement patterns, load distribution, and how the hips and low back are working together. Trying to understand the full picture of what's actually contributing.
At the chiropractic and remedy massage, our clinic, the initial conversation and assessment is really about building the picture with you. Understand your history, your lifestyle, your training, your work setup, all the things that are contributing to fill up your cup.
Because treatment without that understanding is just managing the flare-up. And if that cup keeps on filling up the same way, the same flare-ups keep on coming.
The goal is to break the cycle, not just settle the current episode. So, if this pattern sounds familiar, I want you to sit with something. How many flare-ups have you had in the last 2 years? And how many different things have you blamed them for?
Because if the triggers keep changing, but that cycle keeps repeating, the trigger probably isn't the real issue. The overflowing cup is.
And understanding your cup, what fills it, how full it is right now, and what your body is doing to cope is where the real work starts. If you're ready to stop guessing and actually understand what's driving your pattern, click the link in the description and book your consult with us. We'll take a proper look at the full picture, not just where it hurts, but why it keeps coming back.
Because your back was made to move, not to manage.
Let's figure out what's getting in the way.